Thank you for the kind introduction. So I hope you all enjoyed the night in Melaka, added on the traffic jam. Anyway, okay, I hope you all will enjoy the stay in Melaka over this weekend. Actually, this weekend is not so heavy, I think, traffic, because yesterday there was a replacement school. So actually, I think next weekend or this coming weekend, because of the long holiday, then it will be bad. Okay, I was given saya dibagikan tugas lah, to talk about the role of timeout. In ensuring patient safety, okay? But I think it just timeout alone, you can't ensure the patient safety. I'm sure you all know. Most of you all have worked in OT, and probably some of you are more experienced than me in OT. So it involves the every aspect of the in OT. Okay, I think most of it will be covered by the other speaker, all the thing. And I noticed lah. I mean, I just gone through the whole program. I'm not sure other speakers have touched on it, but I think I will be more based on this. My talk will be more based on safe surgery, safe life initiative in the Malaysian context, and at the same time, just probably emphasize a bit more on the timeout lah. So just nak tahu saja lah. Actually, all of you have been using the perioperative checklist. Semua hospital dah ada. Okay lah, just to ingat, siapa yang belum dari hospital yang belum pernah guna ni, belum guna lagi, semua dah guna. Okay, so that's very good. Okay, so I'm sure you're familiar with the form, all the thing. Okay, and actually, we are coming out lah. We are coming out with another, because always as we go on the thing, we know that there will be some sort of feedback from the staff, and mainly this is used by the staff, the OT staff, the ward staff. Okay, so maybe later if we got time, I just touch a bit on this thing lah. What's the so-called latest progress of this checklist? There's always advantage and disadvantage being a first speaker. Okay, the first speaker usually from the morning you are fresh, but sometimes this is the problem with technology. But anyway, okay, while waiting for the thing, maybe lah, I just talk a bit of, I thought I want to later lah, just talk a bit on the, probably I mean some of you or most of you have known, okay, this Safe Surgery, Safe Life initiative lah, the progress in Malaysia lah, okay. Actually, it first started lah, okay, in somewhere May 2008, okay, where the Malaysia, okay, in general, under the Patient Safety Council, okay, adopted the second global patient safety challenge, okay, which is Safe Surgery, Safe Life, okay. So far, I think the first global safety challenge is, I think, clean care is a safer care. I mean, some of you all may have known. The second is a Safe Life, Safe Surgery, Safe Life initiative. I think the third global patient safety challenge is the antimicrobial resistance. Okay. So since then, the first meeting, okay, I mean in our local context, the ministry adopted that, and the first meeting is somewhere in September 2008, okay, where it's under the chairman of POMR, Datuk Jamil, under the leadership of Datuk Abdul Jamil, who is now the head of General Surgical Service in Malaysia, okay. Gather a group of us lah, okay, gather a group of surgeon, okay, when we adopt surgeon is surgeon, general surgery, orthopedic, ONG, got the anesthetists, okay, got the anesthetists and the also theatre staff, okay, theatre staff. I think Matron Zurina, okay, is in the steering committee, and okay, and I got the honor being invited as one of the steering committee, and being probably the only ONG lah, okay. Probably that time not because I'm good or experienced, maybe because maybe I'm near lah. Because that time I was working in hospital Tunku Jafar Seremban, so probably hospital or ministry don't have to pay so much on my travel claim. So anyway, from there lah, okay, from there we make all the workshops. So I'm sure some of you attended, right? Some of the workshop, I think actually quite a few lah. I can't remember. I think the first one you have in Terengganu, under the sort of territory of Datuk Jamil. So from there we have all the feedback, the training, and finally lah, okay, we officially launched the guidebook, the guidebook on Safe Surgery, Safe Life. And in terms of the Malaysian context, we put the thema, okay, we put the thema of safer surgery through better communication. Okay, we stress on the communication, and I look through your program, and there is also a topic on seminar, symposium on the better communication, and also at the same time, Director General of Health issue a directive in somewhere November 2009, and they want all hospital MOH lah, okay. At this moment we are the thing. Although as the year go by, the private hospitals, some showing their interest in that sense, or some of them they have done their own thing, and to implement this somewhere in January 2010 in all hospitals, okay. But I know that some of the hospitals are started late, they got their own problem, printing the forms or whatsoever. So, but I think now probably almost all MOH hospital who sort of performing any form of surgery have been using that form. Okay, so as the year go by, as I said, we already try to improve on the form and get the form back, and now we are on the way Actually, we are just a draft We are coming on the second edition, okay, of the so-called guideline and guidebook and inside that with the feedback, so we added on some small topic, okay, which I think is important, especially for the junior staff. Example, OT etiquette, use of electrosurgical units. We are talking about the what else? Ada apa lagi? Tak ingat. Okay, surgical site marking. Yes, surgical site marking, prophylactic antibiotic, and the other thing is safe packing of the wound. Okay, safe packing of the wound. Okay, and I'm sure you have heard, or you may be hearing from me, and probably you're hearing from the next speaker, Dr. Nozi. More and more of those kisah benar. Okay, the errors and mishap that happen in operating theatre. Okay, so let me continue. Okay, so basically I just think actually my talk will be quite short. So I think just give some background, introduction, objective for safe surgery. Maybe highlight some of the kisah benar. And I'm sure you all have heard enough, and the timeout, and later to conclude the talk. Okay, so I think all of us know, okay, actually most of those medical errors, all those figures are from a Western thing. Surprisingly, I think so far, I think we start collecting, okay, based on the bahagian amalan, okay, bahagian amalan perubatan, all those through the what we call the incident report and the jatan kuasa siasatan bebas. We start collecting our own figure, but so far I don't see any sort of actual figure, the numbers that really come out. Nobody have counted. I think every hospital collect their own incident report. Okay, so but there's no national. Maybe it's a bit sensitive issue in that sense. Okay, we don't have a so-called proper local data. Okay, bahagian amalan only come up with the amount of compensation or ex gratia that came out every year. Okay, but this is only the Ministry of Health hospital. See, how about the private hospital? Okay, again we are not capturing. Okay, and you'll be surprised. Okay, because of the insurance cover in the private hospital, their compensation are much more. Okay, and then just last year, okay, on the obstetrician, because of the cerebral palsy of a child, was awarded 5 million. Okay, it's true. This is again all those kisah benar, see? So it's not hearsay, and I mean somewhat another, because it's my interest in the medical legal issue also. I was quite often talk to them and have a so-called direct contact. Okay, so I know who is involved. Anyway, so 5 million. Okay, and after the appeal, it was reduced to 3.5 million. Okay, but there's a but there. Okay. The insurance cover for that obstetrician is only up to 1 million. So our friend had to come up. So happened that actually he was my former lecturer. Okay, had to come out another 2 million plus from his own pocket. Anyway, so There's as many, okay, as 10,000 patients a year are killed in the US hospital due to the medical errors. Okay, basically mainly okay, due to the receiving a drug they are allergic to or acquiring a avoidable nosocomial infection. Okay, so in fact the first global safety challenge is clean care. Okay, this is what I try to emphasize on. Okay, hand washing on. And this is maybe just again you are talking about the tips of the iceberg. Okay, although it's 10,000, I'm sure a lot of the cases are not reported, even in US. Okay, so worldwide, okay, there's about 50 million incidents of harm occur in hospital. Okay. Okay, so there's a 10 objective of WHO objective for safe surgery. Okay, so I think I'm sure it's quite straightforward. I just quickly run through the team. Okay, that's why they emphasize the team. We always emphasize the team. Okay, so actually in the timeout whatsoever that later I'm going to talk about, we emphasize on the teamwork. Okay. The team will operate on the correct patient at the correct site. Okay? They always say that, a correct surgery, correct patient, correct surgery, correct site. Correct person to operate. Don't forget. Okay? The team will use method known to prevent harm from anesthetic administration while protecting the patient from pain. The team will recognize and effectively prepare for life-threatening loss of airway and respiratory function. Okay, so this is probably more relevant to anesthetists and anesthesian paramedics. The team will recognize and effectively prepare for the risk of a high blood loss. Okay. The team will avoid inducing any allergy or adverse drug reaction known to be a significant risk for the patient. The team will consistently use method known to minimize the risk of surgical site infection. Okay. The team will prevent inadvertent retain of the instrument and sponsors in a surgical wound. Okay. Again, I'm sure over the years people have come across. So, okay, probably I will highlight some of my own personal experience later. The team was, number 8, the team will secure and accurately identify all surgical specimens. Okay, again it's important. I think it's still, although it's rare, but I think still there's a missing of the surgical specimen. Sometimes I'm not sure how it's happening. Okay, but it's still on and off happen even in my own hospital. The team will effectively communicate and exchange critical patient information for the safe conduct of the operation. Number 10, the hospital and the public system will establish routine surveillance of a surgical capacity, volume and result. And this is, we are talking about collecting data. Okay, data collection. On top of that, in addition, okay, when we are sort of preparing our guidelines and guidebook of safe surgery, safe life initiative in Malaysia, okay, we emphasize on communication, okay. So in addition to that, we add on a few objectives, okay, the understanding of process of surgery by patient and relative. Okay, and I think this is important. Okay, very often when something happens, the relative, the patient will come in, doctor tak cakap, never mention. So actually, it's important. Okay, it's important to what we call the one document that explanation have been given. Okay, given to the patient, given to the relative, and not only, and preferably it should be both together, depend on the thing. Okay, if a patient is unconscious or unfit to sort of listen to the explanation, then maybe to the waris. If the patient is conscious, okay, but we should get the waris to come in. Okay, and I think in Malaysian context, for someone who's single, I think probably parents, right? And for someone who is married, and probably the husband dia lah, atau isteri lah, sebaliknya lah.